Welcome, everybody. Thank you for coming out and spending, what is this, a Thursday evening on your time zone? It's still not quite evening here in Seattle. We're at 4 o'clock-ish. Super happy to be back talking to the Adoptive and Family Foster Family Coalition of New York. I loved the conference. Um, it was amazing. It was such a beautiful community. You all have done such a great job of like continuing to center kinship families and their needs. So I'm happy to be back having a conversation about kinship families and skip generation households. So I will jump in. I'm going to share my screen. Let's see. All right, here we go.
Would I ask you to just speak a little louder? Because the volume seems kind of low on my end. It could just be me, but
Okay, is this better?
yes, that's better.
Okay, all right. All right, so I'm excited to talk about these three pieces that appeared recently in the winter 2025, 2024-2025 issue of Generations Journal. It's the journal published by the American Society on Aging. And they did a special issue on grand families or skip generation households, and that those are families where it's only the grandparents and the grandchildren living in the home, parents go, but that's sort of these families. My colleague here at the University of Washington, Wendy Lustbader, and a colleague, Gaynell Simpson, who's at Georgia Perimeter College, were the guest editors for this special issue. And I think what's also really important about the special issue is that it's centered BIPOC kinship families. And so I've heard from the senior editor of Generations, Allison Bigger, that this has been one of the most read special issues published by Generations. So it tells you something about just how important this topic is for people. And given everything that we were just talking about, we can expect that we're going to see more of these families, right? My students often will ask, how did you get into studying this and doing this is like your life's work? And one of the things I say to them is that there is nothing in terms of a social problem that happens on the planet that doesn't create these families. Whether it's wars, famine, climate migration, unemployment, underemployment, mass incarceration, substance addiction, all of the things like that, those are the things that sort of fuel the need for relatives who are not biological or adoptive parents to step in and raise children. So, super excited about this special issue. And I'm super grateful that I got three pieces in this special issue, which also Allison Biggers, who's the senior editor of Generation, said has never happened. But I submitted these pieces, this piece about dealing with children's developmental needs. And as they read it, they were like, we need this work out there because we deal with so many aspects of these families, but to delve more into the kinds of developmental issues that arise for children who are in the care of relatives and how these relatives interpret and respond to them is really important. So super happy to be having this conversation. I want to thank my many funders who funded this research over the years, and again to AFFCNY for having me back. So I've spent nearly 2 decades now researching and advocating on behalf of grand families, initially as a graduate student and a postdoctoral fellow, conducting qualitative research for my dissertation turned book, Grandmothering While Black, a 21st century story of love, coercion, and survival. Um, I've worked with various nonprofit organizations that provide direct services to families and kinship support groups that offer refuge and resource. I can't enough good things about the significant role that that sector plays in supporting these families. So the photos that you're going to see in my slides chronicle my years of working with these families in Chicago and Atlanta, in Ohio, here in Washington State. So again, one of the underexamined aspects of their experiences is the difficulty responding to grandchildren's developmental needs. I'm going to start by giving you a little bit of context about some of the economic and social vulnerabilities that these families face, and then I'm going to move into the research um, questions and findings. I'm not going to get spend too much time on the economic and social vulnerabilities because I'll be back doing part three of this where we will get more into this later. But I'll just say that most of us know who are here that grandparents and other relatives raising grandchildren and children face significant economic and social vulnerabilities compared to other family types. Skip generation households are the most economically disadvantaged. 63% of these caregivers who are co-resident and primary caregivers are female. And grandmothers who are heading these households are 3 times more likely than two-parent households and 7.5 times more likely than grandfather-only households to be living in poverty. Just significant, again, pretty staggering. We also know that the bulk of grandparent caregiving happens outside of the child welfare system. And what that really means is that the majority of these caregivers only have access to public assistance in the form of temporary assistance to needy families, TANF, and SNAP, the Supplemental Nutrition Assistance Program. My book looks at sort of the unequal system of kinship care where families who are raising children within the child welfare system receive more resources and services than those who are providing care outside of that system. So, a little bit about this area of parenting, developmental needs. I'm going to talk some about the caregivers, then I'll move on to some talking more about the issues that children face. So, one of the things that I'll say as I was interviewing the over 70 grandmothers that I interviewed for my book is that they anticipated caring for their grandchildren in much the same way they had cared for their children, changing diapers, preparing meals, doing helping homework, getting top in the middle of the night to go potty. Most did not expect a secondary and more challenging set of child rearing demands. So, in particular, dealing with their grandchildren's physical and mental health challenges, the emotional difficulties that they experience being separated from their parents, emotional difficulties from past experiences of trauma and maltreatment. They didn't anticipate developmental delays, including learning gaps and disabilities on par with what grandchildren were experiencing. And not only did they not anticipate it, but I would say probably even more importantly, they had very little experience with child rearing issues of this magnitude, not to mention resources to adequately address the child rearing issues that came up. Previous research has taught us that their parenting behaviors are contingent upon several sort of interrelated factors. So, one is their access to financial resources, two, the level of social support that they have in their lives, their own physical and mental health, their relationships with the child's biological or adoptive parent, and the circumstances that led them to become caregivers in the first place. We also know that grandparents raising grandchildren report clinically significant parenting stress, and that health-related limitations, psychological distress, and financial hardship have been found to increase this parenting distress. And that parenting stress is then shaped by having to adjust to the parenting role. It's shaped by ineffective parenting practices and the issues that the children that they're caring for are facing. Children that we in terms of research about the kids that are in the care of grandparents and other relatives. Overall, children that are raised by their grandparents are more likely than those raised by biological and adoptive parents to have problems in school, and that includes everything from experiencing lower educational attainment, academic achievement, and so on. They're also more likely than children raised by other caregivers to have behavioral and emotional problems, though one study did show no significant difference. A recent study using nationally representative data compared the physical and mental health of children in different kinds of families, and that's everything from two-parent households, blended step parents, single parents, and found that children who were being cared for by their grandparents in skip generation households tended to have the poorest health of all children, including behavioral and conduct problems, depression, anxiety, emotional, developmental or behavioral problems requiring treatment and counseling. Recent research demonstrates that family setting and placement types really influence child development, and not just child development in the particular like time that it's happening, but also for later stages of life. Children in kinship care have worse developmental outcomes compared to children who are in the care in the general population. But as many of us know, they tend to fare better than children in non-relative foster care, but not better at accessing the necessary need. Children in kinship care report fewer mental health and behavioral problems and more educational competence than children who are being cared for in the foster care system, not by their loved ones. So basically, yes, these kids are struggling because the oftentimes the best situation is to be with their parent and to sort of make that work. Um, and the traumas and the difficulties that they experience contribute to some of those difficulties that they have when they're in the care of their grandparents, but they're still faring better in the care of their loved ones than they are in the care of uh, non-relatives in the foster care system. So again, previous research has investigated how grandparents in these families both interpret and respond to children's social, emotional, and cognitive and physical developmental needs. And so just a little bit by way of definition, what do I mean when I say social development? I'm talking about the ability of children to create and sustain meaningful relationships with adults and other children. With respect to emotional development, I'm talking about children's ability to express as well as respond appropriately to the emotions of others. With respect to cognitive development, it covers thinking across the lifespan, and physical development involves everything from those fine motor skills to the gross motor skills as well as brain development. So these combined gaps in the research about what we know and don't know about grandparents raising grandchildren and how they respond to children's developmental needs have led me to ask several really, I think, important questions. So what developmental issues do the children in these households that I studied face? How do caregivers support these children's developmental needs? And what challenges do they experience? And what supports do they rely on as they're trying to do that? I can talk a little bit more about my data during the Q&A. I want to kind of get into the heart of the data. So I'm going to start with a quote, and every single one of these articles that showed up in the Generations Journal, special issue on grandparents raising grandchildren, all of the titles came from the grandmothers themselves. I often find that they say things far more eloquently than anything I could ever come up with. And so they've got the titles, I've got the subtitles. And so I'll start with a quote in terms of dealing with children's physical development. 52-year-old Cheryl says to me, at first, they were so sick. They were so sick. So I got them back on their feet. I got them on their feet. So the name of this particular piece is Getting Grandchildren Back on Their Feet and how do they tend to their children's physical development. Her description of the state of her five grandchildren's health when they came into her care echoed the experiences of so many of the grandmothers raising grandchildren that I interviewed. Said they dealt with, while they thought that they were going to be dealing with the kinds of health demands that they were accustomed to, like um, preparing healthy meals, curing routine ailments from everything from colds, flus, broken limbs, and ensuring regular doctor checkups, there was this whole set of unanticipated health demands that they didn't expect. And that was treating preventable illnesses and injuries, alleviating malnourishment, and teaching healthy eating habits, and managing prenatal substance exposure. So I'm going to give you a couple of examples of what this looked like for the women that I interviewed. And so back to Cheryl, whose quote I just used and that I used to sort of like capture what I saw as what grandmothers were having to do with children with respect to physical development. She says about the five grandchildren that came into her care. Chandra had ringworms all in her head, all over her body. Jamal had ringworms stuck all over his skin from sleeping on the floor, all nasty stuff. I took him to the doctor. I put antibacterial on it and all. I went through shit. And they was half eating. They used to half eat. She and other grandmothers, she's 52. At the time of the interview, her grandchildren were 19, 16, 13, 10, and 8. And they had pretty much been in her care for most of their lives. And she took pride in nurturing her grandchildren back to health. Like so many of them talk about, like, the pride they took in getting their grandchildren back to health, restoring their health. She became her grandchildren's legal guardian to ensure that they remained in her care, but also to get desperately needed resources and services. And for her, that meant first and foremost, getting a medical card was significant, cash assistance, and SNAP. And so, in addition to getting them proper diagnoses and treatment for their developmental disabilities and other medical conditions, she also was able to get Social Security for one of her grandsons who dealt with a cognitive delay, which I'll get into a little bit later. Another really great example of sort of some of the, again, treatable illnesses and injuries that showed up. 47-year-old Michelle didn't even realize she was a grandmother until her son called her one day out of the blue and asked her to do him a favor. And that was to get his son. And he had had a child by a woman whose other children were in child protective custody. And so after explaining the situation, she agreed to get this newborn grandson that she barely knew. And one day she is um, had only just gotten her temporary medical card when her grandson, unbeknownst to her, had an asthma attack in her care. And so, if you can imagine, an asthma attack shows up and it's pretty serious and severe, and she didn't realize this child had asthma. And she says, within that time frame, one night he started gasping. I'm like, baby, what's wrong with you? He was coughing a lot, so I thought it was a cold, but he started changing colors. And I'm like, ooh, we got to take him to the emergency room. Shot to the emergency room. Come to find out he's having an asthma attack. Lord, forgive me with the words. Them kids didn't let me know a damn thing. Making me go through all of this. And so she ended up getting, again, the care that he needed at the hospital. And the nurse was asking her, who's the mama? Where's the mama? And she says, I'm the mama right now. You don't need to see the paperwork, just get him seen. And so, fortunately for her, she had just gotten his temporary medical card. But again, something that she said was she was simultaneously afraid and furious. He had to be kept overnight. They gave her a breathing inhaler, pump sprays, all of that. And she said, after she got done scolding her son and his partner and the child's mother, they brought her over his asthma medication. Alleviating malnourishment and teaching healthy eating habits. Children were described by grandmothers who were malnourished. Children who were malnourished were described as grandmothers as small for their age or barely eating. So their poor and irregular eating habits were evident in their stunted growth, their rotten teeth, and their difficulty consuming healthy foods. In response, grandmothers went to great lengths to ensure their grandchildren were adequately fed. So there was one grandmother in particular whose granddaughter's malnourishment actually prompted her to take legal guardianship of her granddaughter. She's 41 years old, and she had been going back and forth seeing her granddaughter at her new home, her newborn granddaughter, with her daughter and her daughter's partner. Her daughter lived with her partner's parents. And she described the sort of culmination of circumstances that led her to become her granddaughter's legal guardian. She says, I got attached to her. I would literally go to her parents' home and make sure she ate. I was going to make sure she ate. I didn't take her home without feeding her. If she went home, I was even paying bills over there to make sure they had a phone so I could check on her. She said, I just kind of took her, and then when daycare was up and I couldn't take her, I just called up here to parent child neglect. And so she talked about how little her granddaughter was and how under nourished she was by the time she got her medical treatment and so on. So that lack of that malnourishment actually was the sort of catalyst for her that made her step in and get involved. 48-year-old Faith described her granddaughter's state when she called DCFS upon learning that her granddaughter had a black eye. So she was the one who instigated DCFS involvement, Department of Children and Family Services. And she says when they took her out, she was muddy. And when I say muddy, she was dripping with pee pee and dirt. No shoes, pamper was sagging like she had the pamper on for about 3 days. Hair was all over her head. She was screaming and hollering too. They jumped in the car, took her straight to the hospital. She was undernourished. Teeth was rotten. Teeth still is rotten at the top of her mouth. So Skylar, her granddaughter, spent 7 months in non-relative foster care until Faith, who lived in Chicago at the time, her granddaughter was in another state, could become her kinship foster parent. And the first thing that she prioritized was nurturing her back to health. She says, "Yeah, my daughters say that the parents, was staying with her, that the girl went and bought 13 gallons of juice, no milk, no food." So she said, she talked a lot about, and a lot of the grandmothers talked about cooking for their grandchildren, even when they didn't feel like it, often despite their own poor health, to nurture them back to health. They catered to their dietary cravings, but also bore the brunt of children's anger in the absence of the junk food that many had become accustomed to. Example of sort of managing prenatal substance exposure. So 21 of the parents in my study were grappling with substance addiction, and two more were in recovery and rehabilitation. What this meant was that for some of the grandmothers that I interviewed, they needed to rescue their grandchildren from being taken from state custody, because this is one of the primary reasons that kids end up, well, pathways for children to end up in state care is when they're born and mothers get tested. We know that women of color get over tested compared to white mothers and so on, but this is a pathway for them ending up in state custody. So they went in to rescue children under these circumstances, and they had to manage the impact of prenatal substance exposure on these children's health, which range from no impact to lifelong developmental disabilities. So, an example of that, I interviewed an 81-year-old who had been she had raised three of her grandchildren as a licensed foster parent, and later she adopted all three of them. When their mother, Melissa, refused to take the training courses to help care for her premature substance exposed baby, fearing that she might get in trouble, she left the hospital and the left the child at the hospital, and the doctors contacted DCFS. When DCFS investigated, they removed him and his two siblings from his mother's care because of her substance addiction. Her son, so this was her son's partner, was in prison at the time, so she ended up undergoing the training and getting her grandson, her newborn grandson. She says his mother left him at the hospital. He didn't weigh 2 pounds. He was tiny, tiny, tiny. When I got him, he was 8 months old and he was hooked up to everything. He had a heart monitor, he had oxygen, he just had everything. I had to take the training for his inhalation therapy and everything to work with him. So she talks about, having to carry around his heavy iron oxygen tank, a special knee stroller, which was heavier and more cumbersome than a traditional stroller. And she just recalls those early days. She was also caring for her, at the time, terminally ill husband. We know that sandwich generation is real, where you're caring for aging parents or loved one, and then you're also raising children. And she says it was just rough. At the time of the interview, she was still undergoing training to care for this now 14-year-old grandson of hers, who was in special education classes over the course of his entire school tenure. And these courses that were facilitated by the Department of Children and Family Services and the Illinois State Board of Education to help assist caregivers attend to the developmental needs of kids with cognitive delays and navigating the special education system. Getting and keeping their grandchildren healthy sorry, excuse me one sec, involved accessing healthcare, which required that grandmothers demonstrate proof of legal guardianship or proof of legal authority. And they did this in a variety of ways. They presented the child's medical card. They provided proof of legal guardianship. They used their DCF paperwork or a caseworker to access health care for their grandchildren, or when they were involved in the child welfare system, as was the case of Louise, who I just mentioned, who was 81 and stepped in and raised her newborn grandson. She took on the caregiving arrangement required by the state, which in her case was to become a licensed kinship foster parent. Not every grandmother that I interviewed was willing to do what it took to become the grandchild's legal guardian or assume the care arrangement required by the state. And there are lots of reasons why they didn't have legal custody or authority. Sometimes the parent had it and refused to relinquish it. Sometimes the grandmother herself was like, I want my kid to get it together because I actually don't want to raise my grandchild. So I'm trying to hold out for getting legal guardianship. So when they didn't want or couldn't get legal guardianship, and again, there are lots of reasons, there was just a couple, they got their grandchildren medical care by using trusted relationships with the medical providers in their lives. So they sometimes took them to the same doctors where they had taken their children. They negotiated with parents, I'll do the raising, just take the child to the doctor. So they would rely on the parent to, overcome that lack of legal authority. Or sometimes if a medical provider asked if they had legal authority, they would just give verbal confirmation that they did, even when they didn't. So again, another article dealing with children's cognitive development, and again, another great title that came from one of the grandmothers herself. This is a title from Angie, who, when I asked 45-year-old Angela what she wanted for her grandchildren's future, this is the best answer ever. She said, I really just want to put God in them and education, and they can take it from there. Yeah, so I'll get back to in a second how grandmothers put that education in their grandchildren, but I'll also start by saying that how do they take care of their grandchildren's cognitive development across the life course? Because as we know, children's cognitive needs, we were talking about brain development before we even jumped into this workshop, they change over time. And so I'll say generally until a child was enrolled in pre-K at about the age of 4 or 5, grandmothers were the ones who were primarily responsible for teaching their grandchildren. And along with the child's doctor, they were responsible for noting whether or not their grandchild was reaching an appropriate developmental milestone. So it was the grandmother, the child's doctor. Once children became preschoolers, early childhood educators also taught them and assessed their development. So now we've got more people who are helping to sort of make sure this child is where they are supposed to be developmentally. Along with healthcare professionals and caseworkers, early childhood educators communicated with grandmothers about developmental expectations. They communicated with grandmothers about developmental concerns, and they directed them to early intervention programs where needed. When children got older, as children 5 to 12 or adolescents 12 to 18, their educational needs were cared for by grandmothers by ensuring that they attended school, that they behaved while they were there, and that they did their homework. Their hands-on involvement, which included tutoring them, volunteering at their schools, was meant to keep their grandchildren on track and demonstrate that someone cared not just about them, but about their education as well. This involvement was contingent upon the child's age and educational needs, and the grandmother's relationship with the school, with the teachers, with the biological parents, and then finally with the grandparents' time, energy, motivation, and capacity. At this stage of children's lives, when they're children and adolescents, you've got now healthcare professionals, caseworkers, potentially teachers who are all monitoring children's development um, at this stage of the life course and helping grandmothers get the appropriate evaluation services when they were concerned about any developmental issues like getting an individualized education program, an IEP. So Angela, who talked about wanting to put God in them and education and they can take it there, um, demonstrated how she prioritized her 9 and 5-year-old grandchildren's education in her daily child rearing practices. She put that education in her grandchildren by reading to them nightly, volunteering in their classroom, and she was not alone. Grandmothers routinely supported cognitive development by observing their learning abilities, building cognitive, language, and communication skill building tasks and activities into their daily routine, and by devoting time, energy, and resources to teaching their grandchildren and to facilitating their education. So, just a few examples of how grandmothers did this across children's life course. 69-year-old Ida typified how grandmothers taught age-appropriate cognitive skills to toddlers. Ida and her husband, UZ, became their newborn great-granddaughter's licensed foster parent when she was born with neonatal drug exposure and taken into state custody. She described teaching 1-year-old Sugar colors, letter recognition, and hand-eye coordination. She said she's learning to walk. She watch you. Whatever you're doing, she gonna try to do it. And you try to hide something, she goes right to it because she look. She learns so fast what color you had, and she go right to it and find it. She was planning to add ABC blocks to Sugar's play and learn sessions, and she was also teaching Sugar to use crayons to scribble, the precursor to teaching her how to write. 41-year-old Shalonda demonstrated her how grandmothers supported their grandchildren's education when an early childhood educator or teacher expressed concern about cognitive delays. When her, and this is the one who took her granddaughter because she was malnourished. When Shalonda's granddaughter, Dana, was in kindergarten, her teacher expressed that there was a gap between her ability and age expectations. Initially, Shalonda didn't want to believe, quote unquote, the assessment. But after Dana's teacher explained it, she accepted it. She said, I bought phonic games, cards, flashcards. I pinned words up around the house, letters on the refrigerator, on her door, all kinds of stuff. I'll be riding in my car and say, what color is that? What does that say? I will do all that. I'll do that all the way to work, all the way home to kind of help her keep up with her stuff. Over time, Dana's grandmother, child care provider, and preschool teacher helped improve her learning ability and outcomes. Although Dana was now spelling words, she's reading well, she's still not very good at homework, not doing it, but turning it in. Shalonda divulged Dana's first grade teacher's verdict: her attention span is not where it should be. So again, sort of dealing with the things that come up for kids and just being incredibly hands-on and involved to the degree. And this is, somebody's working full time. She's raising her own children. It's pretty extraordinary. Cora was one of many grandmothers who attended school events and teachers' conferences and volunteered at their grandchildren's school. She had raised 6 of her 8 grandchildren because of their mother's drug addiction and distressed romantic relationships. At the time of the interview, she was still raising 2 of them, an 18 and 15-year-old. She kept track of and called the homes of, so she went to the volunteer at their school, and what she did when she volunteered was keep track of and call the homes of kids who were missing from school. She said, and that would help my grandchildren. I see them every day they go to school. I'd be right behind them. And in addition to showing them that she cared, Cora's presence kept her grandchildren, what she says, in line, meaning well behaved. Another grandmother, 81-year-old Virginia, great grandmother in this case, and her husband Norman. When I went to go interview them, their kitchen table was piled with large stacks of index cards that she had made for their 11-year-old great grandson. He had been distracted in school recently because he was visiting with his father, who'd recently been released from prison. She described, I sit up here sometimes, like the other night, he went with his dad and he lied about his homework. So he got home late and he was tired and he went to bed. I stayed up and it was some kind of math, and I'm not the best in math. Some of this new stuff that they have with the graphing and stuff. Anyway, I stayed up until almost 4 a.m. trying to get this stuff together. And then I got him up and tried to explain it to him so he wouldn't get an F. What happens when children do exhibit cognitive delays and disabilities? A cognitive delay is related to a child's inability to process information intellectually based upon what is appropriate for their age. So, in addition to it impacting a child's ability to think, learn, and problem solve, a cognitive delay may also impact their communication, their behavior, and their social skills. Approximately 12 in 1,000 children in the US have a cognitive delay, ranging from mild to severe, and includes everything but is not limited to learning disabilities, attention deficit disorder, attention deficit hyperactivity disorder, and autism. Grandmothers were often the first to detect cognitive delays in their grandchildren because they spent the most time with them. Children in the study exhibited cognitive delays and disabilities due to neonatal drug exposure, biological or birth-related issues, and this is everything from being born prematurely, having genetic conditions, and poor eyesight or hearing, or for unknown reasons. When children exhibited cognitive delays and disabilities, grandmothers found themselves in one of two positions. In the first group, these were grandmothers who were aware of the source of the children's symptoms because it was often the reason for them assuming care to begin with. In the second group, there were those who were forced to try to uncover the cause of their grandchild's issues. Grandmothers in both group had to intensify their institutional embeddedness. And what I mean by that is you've got to bring in more players. You got to get to the doctors, you got to talk to the teachers. So you're getting specialists, you're needing help with figuring out why isn't my grandchild where they should be developmentally. Cheryl, who was the one who talked about getting her grandchildren back on their feet when she got the five of them, noticed, she's 52, she showed how grandmothers noticed and responded to children's cognitive delays when they had information about the possible cause. She says, when Tevin was born, he used to cry all the time. I mean, all the time, just cry. I say, why you cry so much? Come to find out he was having withdrawals from that reefer or drugs or whatever she was on. She wasn't staying with me, so I didn't know what she was on. He used to jump all around all the time. When he was first born, he used to do everything strange. And she later learned that her daughter had a crack cocaine addiction at the time that she was carrying Tevin. Cheryl took Tevin to Chicago Memorial Hospital to get him tested. And in her words, when they got through with him, he had everything wrong with him. Glasses that thick, everything. Attention deficit disorder, learning disability, everything. Tevin attended special education classes through the 11th grade. He shifted to general education classes in the 12th grade and was attending college when I did the interview with her. She repeated that process with another grandchild who was also later diagnosed with ADD. Another example, when a caregiver knew the source of children's cognitive delays, 48-year-old Natalie and her husband Rod described the impact of him being born a preemie at 15 weeks, weighing 1 pound, 11 ounces. She says, so he spent the first 9 months of his life in the hospital. She laughs. So he was like developmentally delayed. They try to put a lot of labels on him, and I'm like, it's not going to happen. This boy's going to be okay. He's graduating and going to the first grade this year. And I asked, and they tried to say he was developmentally delayed. And she said, they tried to put a lot of labels on him. He is a little bit delayed. I mean, I was in denial. There's nothing wrong with him. He's going to be fine, but he is a little delayed. There are a lot of things his younger brother can do that he can't. So Natalie pushed back, but pushed back against placing her grandson in special education, but did agree to do an individualized education program and watch him. So she illustrated the hesitancy and sometimes resistance that some of the grandmothers had about getting their grandchildren diagnosed with a cognitive delay. They did not want them to be labeled with that delay. And in Natalie's case, she said, I didn't want it, special education. So with the evaluation, they said he really don't need to be in there because he is keeping up. I didn't. I don't want labels on him. And I'm going to give an example of a grandmother who's having to deal with these cognitive delays showing up without any information about where they came from. Her daughter was not on drugs, and her granddaughter actually ended up in her care because she was showing these signs. Her daughter could not handle it and couldn't care for her. 48-year-old Kathleen, her granddaughter is now 15 years old, Tawana, talked about how this manifested for her. She says she stayed in Pampers until she was about 2 and 6 months. She couldn't talk. It took her, let's see, how old was she when she really started speaking words? Probably about 10. And okay, about 12, she started speaking sentences, but not complete sentences. It took her 4 years to get her granddaughter properly diagnosed. I stayed at every hospital. It took me years trying to determine what her diagnosis was. No doctor could find a diagnosis to determine what was wrong with her. My daughter had a normal birth, full term, but they couldn't understand why she was like she was. So I took her to all these hospitals in Chicago, and they ultimately came back with developmental delay. When children exhibited cognitive delays and disabilities, grandmothers sought institutional support, even as they faced additional barriers that are not experienced by parents, including not being legal guardians, not having all of the necessary information to assist healthcare providers with diagnoses, and a fear of losing their grandchildren should they seek assistance. So, to respond to this, they communicated with teachers and healthcare providers as much as they could about learning problems. They advocated on their behalf with teachers, administrators, caseworkers, social service agency staff to ensure that they received the resources, services, and support they needed to learn. Grandmothers' limited experience with cognitive delays and disabilities, combined with their lack of legal authority, sometimes impeded their ability to get children the resources and services that they needed. And then lastly, dealing with children's emotional needs. And again, another great title from one of the grandmothers herself. Um, this particular article explored how they fostered healthy social and emotional development by helping their grandchildren cope with difficult emotions. So they're dealing with physical development. And the thing about it is these all, as we all know, happen simultaneously. They don't get to like piecemeal it and say, can I deal with one at a time? It's often a configuration of all of these different things, playing out together. And so some of the difficult emotions that came up, I would say there are three primary ones. One was parental absence and parental presence, right? Because sometimes the whole parents coming and going could be incredibly disruptive for children's emotional well-being. Stigma associated with being raised by their grandparent and prior adverse experiences. And so I want to give you some examples of those. Grandmother sought to fill the void created by parents' inability or unwillingness to be there by being present, assuring grandchildren that they could stay with them for as long as they wanted, and or promising them that they would never leave. 51-year-old Dorothy, or I'm sorry, 50-year-old Dorothy, who used Child Protective Services and the police to become her grandson's legal guardian and keep him in her care, captured the essence of some of these assurances. He, her grandson, said, "Grandma, I don't want to go with my mom. I want to stay here with you." I said, "You don't ever have to go anywhere else. You can stay with grandma." And when he seen his mother coming, he said, "Grandma, don't forget, I want to stay here." And I say, "You don't ever have to go. You can stay right with grandma." 63-year-old Cora made a similar promise to her wary 15-year-old granddaughter. She sit down one day, "Girl, it hurt me so bad." She said, "Everywhere I go, somebody put me out." I say, "Why you say that?" She say, "My mama, she puts me out." I say, "Grandmama never will put you out." I said, "I'll never put you out." And she got like a little smile on her face when I said that. That hurt me so bad. I never will forget that. Being there for their grandchildren was complicated for by children's separation anxiety and abandonment fears. Grandmothers combated separation anxiety by explaining any anticipated absence, reassuring the children that it would be temporary, or sneaking away in hopes that their temporary absence would go unnoticed and not cause further emotional harm. 41-year-old Barbara had been raising her 4-year-old grandson, Shaquille, since he was an infant, and he still suffered from separation anxiety. She explained, anybody that he gets connected to, he doesn't want them to leave because mama already gone, then daddy gone. It's like, oh, is mommy gonna be gone too? So I have to reassure him, mommy not going nowhere. The only way I leave you is when mommy go to heaven. I understand you don't want me to go, but sometimes mommy have to go and mommy have to do things without you. Grandmothers often also face the daunting task of explaining parents' absence and helping their grandchildren craft a perspective that would nurture rather than undermine their emotional well-being. Here's Dorothy again. One time he said, Mama, why don't I see my mother and dad? They must be dead or something. I said, no, they're just not around. He said, Mama, everybody else's mom and daddy bring them to school. My grandmama bring me to school and I'm sad. I said, be thankful to God that you got somebody to bring you to school. Your grandma is here for you. You got to be thankful to God for that. Like many others, she helped to care for her help her grandchild cope with parents' absence, specifically the negative effects of parents coming and going. Younger children tended to act out when their parents were coming and going, having tantrums, having bedwetting episodes, potty accidents, and older children often blame their grandparents for non-reciprocal punishment. Grandmothers learn to be empathetic rather, to the acting out associated with parental visitation, as well as to behavior resulting from parents coming to visit. In both cases, they tried to strike this balance between understanding their grandchildren's experiences and arming them with the truth. And I love this story by 54-year-old Laverne, who had been shielding her grandchildren for much of their lives, why their parents weren't around. And she could only do this so long until they started getting older. She is raising 5 of her grandchildren, her and her husband, Leonard. And recently, they had been dealing with a difficulty of their grandson acting out because his father had gotten married and left the state. I'm not sure. Is my internet okay? Chester, am I good? Because it says I'm okay, good. She says, now that they're bigger, it's a little rougher to deal with because when they were little, we could go grab them and go to Chuck E. Cheese or go to the beach. They're too big for that now. They've started to see things more for themselves. He, my grandson, was trying to smell his tail, as old folks used to say. So I have to break things down for him every so often, and I have to catch my mouth and remember that he hurt and he a child and he don't understand. He says, you just don't want me to be around my daddy. Baby, stop that lie. Don't never let nobody tell you that lie. I've never stopped him from being around you or coming to get you or whatever. Don't ever let nobody tell you that. I ain't trying to fight nobody for their kids. I keep you for a reason, to keep you safe, to raise the 5 of you together as brothers and sisters. So, children experienced a variety of reactions to parental absence, including anger, self blame, emotional regression, acting out, and even depression. When their individual coping strategies didn't work, grandmothers sought institutional support to help their grandchildren deal with their difficult emotions. Laverne, the same grandmother, her granddaughter was also 14, having a really hard time after spending time with her father. And she said, I recently took her to a psychiatrist at Michael Reese Hospital, and he put her on this medication. She has a lot of anger towards him, her father, but then she has a lot of love for him. So things just go back and forth, back and forth. Then she came back home. It was pretty much she brought some of it with her, and it just kept seeing different actions from I kept seeing different actions from her. So I took her to the doctor. Mood swings, a difference in her behavior, and so on. Children's behavioral problems, especially habitual lying, stealing, anger, acting out in school, strained grandmother's capacity for empathy. These problems not only challenged their ability to exercise empathy, but they also exceeded their personal resources. In these cases, many grandmothers resorted to informal support systems and institutional ties like healthcare providers, caseworkers, and educators. Assistance from formal support consisted of assessments aimed at getting at the heart of children's behavioral issues, advice on symptom management, medication for symptoms, and mental health services. Managing grandfamily stigma was another challenge in terms of children's emotional needs. A lot of existing research I found focused on the stigma that grandparents experience as primary caregivers. I found that grandparents weren't worried about how people perceived them as much as they were worried about how their grandchildren were being perceived by their peers for being raised by them. So, for instance, Shalonda, the 41-year-old who had rescued her granddaughter because of malnourishment and the living condition she was in, and her husband had raised her since she was a newborn. And when I went over to do the interview, they had had this recent conversation with her, which I thought was pretty compelling. She explained, she got me in a corner and she said, Mama, I've been intending to talk to you. Can you quit telling people you my grandma? And I think maybe now she's at the age where, like, with school things and things, so everybody there with a mother and father. So she called us mom and dad, so you wouldn't know unless we told you. So she said, "Can y'all do that?" So I was like, "Okay, I ain't got no problem with that." She was one of the many younger grandmothers who agreed to be called mama. Unfortunately, older grandmothers were unable to pass as mothers, making it more difficult for them to reduce the stigma experienced by the child in their care. 81-year-old Virginia, who had stayed up all night making those index cards, said, at school, the other kids got moms and dads. Who is there with him? His grandma. They say, "Oh, Omar, here's your grandma." It hurts. And the other day we went to his competition for the band. All the parents were there waiting in the cafeteria because they had their solo competition, and I'm sitting there. He had told his mother this time she came. Gregory, one of his little classmates, he told Gregory when he came back from the judges, "See, Gregory, I told you I had a mom." Isn't that sad? I wanted to cry. Another grandmother, great grandmother raising a child, she was 74-year-old Marion, had a different response to her great granddaughter Melina's stigma. When Melina's teacher corrected her, telling her that her great grandmother was not her mother, Marion pulled the teacher aside, telling her that it wasn't her call to make the distinction in front of other people. It makes her feel less than or like she's deficient in some kind of way. Caring for children with a history of adverse experiences. The circumstances surrounding children's transition into their grandparents' care made it important for grandmothers to be sensitive to the impact of any adverse experiences their grandchildren had had. They saw children as victims of their circumstances. Grandmothers went to great lengths to cause no additional harm, including not using physical discipline or using it less, even if they had done so with their own children. And that was something that really kind of blew me away. Instead, grandmothers stressed listening and talking to their grandchildren to create a sense of safety. Faith, the 48-year-old who rescued her granddaughter from foster care in another state, her granddaughter was 3 at the time that I did the interview. And she said, she described the difference between raising her 3 children and her granddaughter. She said, because mine's, I had to look at them and they knew. I didn't have to open my mouth. This one, I could look at her and she still does. She says, but she's been through so much and I don't want to mistreat her. And that's not going to be fair to her. She needs to grow up to be a happy young lady. She doesn't need to be mistreated. She's already been mistreated for the first 2 years of her life. Actually, not the first two, but when she was in her mama belly. When Faith mentioned that she didn't want to mistreat her granddaughter, what she meant was that even when she wasn't as well behaved as her children had been, she didn't want to use physical discipline to make her behave. She took into consideration that she hadn't been taught how to behave by her parents, which meant that she couldn't have the same expectations that she did for her own children. And she also took into consideration her history of abuse. Most grandmothers describe using talking to get an understanding with their grandchildren, which Cora explained meant addressing disciplinary and behavioral issues without resorting to physical violence. She said, I don't beat my grandchildren. We can talk and get that understanding. That's the greatest thing in the world. You don't have to beat no child just all the time, just hurting them kids. You can sit down and talk with them. And then I'll end with a great quote from Marion, who had the granddaughter whose teacher distinguished her being the great grandmother and not the mother, or corrected her being the great grandmother, not the mother. Consistent with other research, getting an understanding required grandmothers to be explicit with language and to talk to their grandchildren instead of at them. Many talked about using direct eye contact. So she explained how she used direct contact to communicate with her grandchild. She said, I don't have to hit Melina. I can say, come here. She hates for me to get down on my knees and look at her in her face. She hates it. You ought to see it. She just wilts like a flower. I get in her face and I say, how many times did I tell you to do that? Do you think I'm playing with you? Did you not hear what I said to you? And when I talk low like that, she don't like it. And she just cringes. And she'll think about it and she'll say, Grandma, I'm sorry. I apologize. Would you forgive me? And I say, yeah. And she says, similarly, she had created such a safe space with her great granddaughter that she could also express herself and share her feelings. She says, and then she'll come to me and say, that was not nice, what you said to me. And I think you owe me an apology. And I'll say to her, well, let me think about it. I say, Melina, you know what? You were absolutely right. I apologize. And will you forgive me? She says, yes. And then we're okay. So I think this research provides some insight into how caregivers both interpret and respond to children's developmental needs. The unanticipated developmental needs that they had were exacerbated by a lack of resources and legal authority. So I think these findings are also incredibly crucial for designing effective supports and services. I'll stop sharing my screen.
Yeah, that's great. I had a couple questions. Well, one is I wanted to. It sounds like it was a super group of grandparents. First of all, and I was wondering if how did they get to be in your study? I mean, how did you throw that rope out? Did you just go to super grandparent school and pull them all
I
out, or
know. Wouldn't that be great? I need one of those all the time. I'm looking for grandparents right now for a study. No, so I recruited various ways. I um hit up a lot of social service agencies that I knew work with this population. I sent them flyers and letters about the project. And one of the great things is that not everybody responded, but I was pretty surprised by the overwhelming response for people to say, oh, absolutely sure. And one of the things that I did with all of those agencies and everything from Metropolitan Family Services in Chicago, Catholic Community Services in Chicago, there's another agency and I'm missing the name right now. They were amazing. I volunteered myself. I'm like, I can come and share some of the findings. I came and gave talks. I did National Grandparents Day events. So, I felt like I wanted to also make sure that I was being a contribution. I also hit the streets a lot. I went to places where I knew these women were. I posted flyers in laundromats, beauty salons, grocery stores. I sent letters and flyers to churches. And then it snowballed from there. It was literally like people telling people about the work. And it was so surprising to me and so sad that many of the grandmothers felt like what they were going through was theirs alone, that they were very surprised that other people were having similar experiences. And they were also really happy to share their stories. They didn't think anybody cared. And
Mhm.
so it was, it was not difficult getting all of these women. I think one of the things that became difficult later was I got funding to go back and look at grandmothers who are raising grandchildren 5 and under. Because
Mhm.
one of the things that we don't think about enough to me is that grandparents provide the bulk of childcare in this country. What happens when you're parenting a child and you're the grandparent and you need childcare? How does
Yeah.
that work for you. So I went back and looked for more grandparents raising children 5 and under. But those were some of my recruitment strategies. So far, so good, Chester.
Well, I noticed that we had at least one volunteer for your upcoming study, so you might want to take that note.
Okay.
Well,
I will. Thank you, Donna.
that led me into another question. I was curious how many of those folks were involved in foster care, whether the kids were in or not, and how many of them weren't.
That's a really good question. I have that number somewhere. So it was interesting. One of the things that I went into this looking at, here we go. Do I have those numbers? I do not. I will pull them up and share them with you. So when I first started this, grandparent headed households is a big umbrella, right?
Mm-hmm.
So that could be multi-generational and that can also be skip generation, which is I landed on a skip generation. What I figured out very soon was that the issues that came up in multi-generational households were fundamentally different than those that were coming up in skip generation.
Mm-hmm. Mm-hmm.
And I wanted to look at how those women who were having a parent without the parent living there and navigate all these systems that are built for parents,
Mm-hmm.
parent-child families, now for grandparents raising grandchildren.
Right.
And then I got into as the child welfare system is very inundated in poor Black communities, I couldn't ignore the impact of the child welfare system on these families. And so then I
Yeah.
decided I'm going to still have enough representation of the number of folks who are providing care privately because that's the bulk of caregiving. But I wanted to then look at how do I get at these grandparents whose grandchildren have been taken into state custody,
Yeah.
those who I later learned were diverted away from the child welfare system and placed in their care and not take, so kinship diversion. And so
Yeah.
then I started having to turn away the ones who were doing private care and start trying to just find more who were doing care within the child welfare system. I have the numbers in my book. I'll pull it up, Chester. But one of the
Okay.
things that I'll say was harder about getting people who were providing care in the child welfare system is that they were less trusting. They were all
Yeah.
dealing with the child welfare system or had dealt with the child welfare system. They were
Yeah.
trying to share issues with you, like for fear of having already had that experience, not wanting to have it again. So it was harder to get them, but man, that was incredibly rich too, because that was also a very different kind of experience. And many of the grandmothers stepped in because they didn't
Mm-hmm.
want to be having their grandchildren end up in the child welfare system.
Yeah. And that makes you sometimes that's a problem because the folks who are don't want to get involved. Oh, that's the book there, right? Don't want to be involved with the system are also like averse to a lot of the things that the system has to offer that are positive, aside from just the financial resources. I mean,
Yeah.
like in our situation, we have families that um, could really benefit from the parent training, from the just
Yeah.
understanding a new kind of dynamic in the home. But it's hard to get those folks in because, as far as they're concerned, we're the big bad system.
Yep. Absolutely. Absolutely. And I think, they have all kinds of reasons to be afraid, right? And
Oh
so it is like just building those trusted relationships with individuals within agencies and with agencies, right? Like for instance, Metropolitan Family Services was a really supportive space. And a lot of the grandparents felt like they got a lot out of like, was it worth it?
yeah,
Was it worth it getting like Louise with the parenting classes, having a child with cognitive delays? And in her case, it was.
yeah,
And so my thing was always, let's give them the options. And
yeah,
that is too often what doesn't happen, like that we lay out this range of different care arrangements that are available to them and the pros and cons of what choosing one over the other means.
yeah.
And many say that they didn't get those options.
Oh yeah,
One way or another, they didn't get them. And some wish that they had gotten, some involvement with the child welfare system because their grandchildren's needs were so
that's right.
um
Yeah.
severe. So, and I've got that answer. So, at the time that I did the interview, the grandmothers in my care were caring for 134 children,
Mm-hmm.
30 through private kinship arrangements, 71 in legal guardianships, 3 through kinship diversion, 16 kinship foster care, 4 subsidized guardians. So once they phase out of foster care, subsidized guardianship, 10 kinship adoptions, and 1 private adoption.
Wow. Okay. We had a wide variety of
A nice,
Yeah, I wanted to
that's a
understand.
nice study.
Yeah, well, how were they like how were they making decisions when they timed out of kinship foster care? Why were some choosing adoption versus subsidized
yeah,
guardianship? And
yeah,
so it was really quite amazing to kind of understand what that decision making looked like and the
yeah.
things that went into that.
Did you have any interactions with the child welfare system before the book?
I did not.
Okay.
One of my mentors studies the child welfare system, Dorothy Roberts. You all have had her, I think.
Oh yes, yes, yes,
Yeah,
yes.
she was my mentor in graduate school at Northwestern. She was on my dissertation committee, and
Okay.
so her Shattered Bonds, and then later um, the newest one on abolishing the child welfare system
Yeah,
is yeah, that's her work. So her thinking definitely shaped my own as I was kind of understanding this work.
yeah. I guess, and one last thing for me, I was wondering if, because you talk about this one agency that you felt real positive about. Now, were they was is the positivity because they were open to you and what you did, or what did they do that struck you as so positive?
So a lot of the grandparents that worked with this agency just got a lot of resources and services, like a lot of support. So they had parenting classes for the grandparents who, were dealing with the stuff I just laid out. They
Yeah,
were dealing with those issues and bringing people in to talk about those issues. One grandmother, I didn't share her example because I knew I wouldn't have a lot of time. She ended up raising, I think, five or six of her grandkids. She learned about their early Easter seal, early intervention programs, because
yeah.
she was going there to get support for caring for her mother-in-law. And
Oh
so, like,
wow.
of course, sort of wrap around, like, she'd already been involved. They have something to give her, right? She
Mhm.
had these five or six grandkids who had every single one of them, with the exception of, I think, one, had a cognitive delay or disability. They came to her home. They
Yeah.
provided support and and built that trusting relationship. Like, she wasn't afraid of them. And
Mhm.
and didn't feel judged by them. And so I think, like, providing actual tangible support. How do you do an IEP? How do you deal with these sorts of issues when they come up? And often, the peer support is amazing, but also having people come in speaking about these different issues was also incredibly amazing. So I think just they were helpful. They were helpful to them.
Yeah. Actually, providing a service. It's an amazing
Yeah,
thing.
yeah, I know. And obviously these agencies, they're not the child welfare system, so they don't have a lot of resources in terms of
Right.
tangible material resources to give, but they can often direct where to go to get things. A lot of the grandmothers found out about, a program at Larabita in Chicago where they could take the grandkids to be assessed. So
Mm.
it's like building those kinds of, so the agency provided services directly, but they also had built relationships
In the
with
communities.
can
Yeah.
and they knew, like, this is where you go. They're gonna take care of my people, right?
Yeah.
And so they've done some of that work for them because they're so stressed and so pressed. I don't want to have to go into an agency and figure out who I can trust all the time, or are they going to give me good information? And this agency had worked to cultivate a lot of those relationships and made a big difference.
Yeah. Where can we get your book?
Anywhere, Chester,
I
it
know.
is.
Because
Some
you
of
got
us
you got
have
all
it.
those. I'm sorry, Amy. You've got those narratives in the book, right? The stories you
Oh,
were telling us.
oh, these are not. This is what's so bananas is that I wrote this chapter. What you all what you just got exposed to were three different pieces that were broken up for the special issue in Generations this winter. I wrote
Mm.
that chapter for the book, and my editor was like, "You ain't got no more room." So I know. And at 300 some pages, they're like, you're done. And so I've been sitting on this chapter and I was like, this is so important. How do I get this out there? And then when they were coming out with the special issue, they're like, we've got nobody talking about developmental needs and
Yeah.
how these caregivers are responding to them.
So how do we is this a magazine you said it is? What
Yes,
is it?
I'm gonna put the link in the chat.
Okay.
Okay.
Yeah, no, that would
'Cause
be great.
I was thinking some of those narratives, those dialogues, the back and forth between grandmas and the kids. I mean, that's perfect kind of, script work that people should hear. Situations that we could use in our parent training and all that kind of stuff.
Hey, you got to tell me. I mean, honestly, like I would be like tired and I'm like, oh, I gotta go do another interview. And every single time I'd be like, oh my God. Like just, and once I started doing this research, I have to tell you, I started working with this population. I was incredibly clear very early that this was what I was going to spend my career on. Like I love these families. Like it is just,
Yeah.
yes, it's
Yeah.
it's pretty special, I have to say.
Good deal.
I think it's so important to meet people where they're at too. Like you said, going to where people might be. And we've been talking about that on in our teamwork is, issues can be the same across the board, but you have to go where the people are. And kinship families do have stigma and they are overcoming a different kind of issue than other people, and that's what we've been trying to do. Well, where do grandparents go? Where are you going when you have these socioeconomic challenges, but you're not waving a red flag? And we've talked about places like the library because there's great programming there and it's free, and different places like that.
Yep.
And also we look at things like this. Like some of the things you said prompted me because I plan a lot of programming and Chester and I co-facilitate together. And I was thinking maybe we need to do a mental health and emotional needs night. And we need to do a stigma night. And we need to do like you're getting the phrase getting back on your feet or getting the children back on their feet. That's the simplest, most powerful statement,
I
right?
mean,
I
and
mean,
honestly, again, it didn't even come from me.
yeah,
It's like one of the things
so
I love
perfect.
about being a
Yeah.
sociologist is I get to like find the patterns and
Mhm.
not just across my work, to be clear, I it's very well researched. I'm finding the patterns in the literature as well, like what other people have also done. Like what do the big quantitative studies have to teach us? But then how do we get at beyond the statistics to get at the real lived experiences and the words, you can't say enough to you all's point, like what you hear them say and how you hear them articulate what they're experiencing helps us help them, right? Like I
Yeah.
think just understanding how they're understanding their reality and the barriers that they're facing and their resilience. What are the things that they bring, the strengths? I mean, those grandmothers who are like, I'm down on my knees talking to my great grandchild and you know, and just I'm never gonna leave. I mean just yeah, I mean that yeah, I'm still like not happy that it didn't make it into the book because I feel like that piece around seeing that day to day how they're loving on these kids. So my book deals with like how are they getting resources, how are they dealing with the child welfare system, how are they dealing with parents, how their own mothering shape where they are. But like that whole like the heart to me in that way is like how are they dealing with them babies, how are they and they're the anger that they feel, especially as they get older and they start being disrespectful or like the grandmother says, smelling themselves,
Mhm.
what do you do with that?
Have you
Yeah.
come
And it,
across like a grandparents network, either national or locally?
Have I come across?
Yeah, in your studies and travels. I mean,
Yeah,
is there like a collective group of grandparents out there doing stuff? Or?
that's a good question. My friend and collaborator Barb Taylor is on here. I'm gonna call her out because she's got her camera off, but Barb works with the King County Kinship Collaboration under Catholic Community Services here in Seattle. She may know more about that than me. I know a lot about a lot of localized groups.
Mhm.
Um, and there's even now, what's interesting is like more stuff around empowering grandparents. So I'm seeing people
Mhm.
kind of come up with more of that, which is interesting. I actually connected with two women who have created new organizations on empowering grandparents because they're grandparents and they're like, what does this stage of your life need to look like or could look like? I don't know about national though, that's grandparent caregiving centric that they've kind of spearheaded themselves. I'm not sure, Barb, do you know of anything like that?
I mean, the first, sorry, I'm on my phone, so I can't turn my camera on, but the, I mean, The one thing I thought of was Generations United advisory group of kinship caregivers. They have a large group of kinship caregivers from I think every state,
Hmm.
and they do advocacy and they do media work, really great work.
I am so
Generations
thank you,
United.
Barb.
Okay.
Thank you. See, Barb is amazing. That's why I wrote Barb.
No, that's great.
Yeah.
One thing I'll say, this is so funny. So when I was at the American Society on Aging presenting this work, back in April or May, I think it was April, it was in Orlando. I was on a panel with someone who was one of those advisors, and she was looking for more kinship caregivers who wanted to get trained by Generations United. They get a stipend,
Oh,
and they go around advocating and supporting caregivers. So I can get that information. I actually, like, I literally feel like I was looking at her card today, and she was amazing. She Native American grandmother raising her, I think it was a grandson, and Donna Butts was there from Generations United in the audience supporting this program. Um, yeah, I think that's a really good resource, Barb. Thank you for that. I'll
Yeah.
put that in the link, put that in the chat.
Yeah, I think one of the takeaways too is the strength and the empowerment, and it's self-empowerment and it's strength. There's even more strength in numbers, and there's even more support in numbers. And we say the same thing, and I think you said this is, I'm always surprised at how many people feel alone, and it doesn't diminish to say you're really not alone. There's a whole community of people experiencing the same thing. So that whole connection, that the way society looks at people and the stigma in general, and children having to say, can you say you're my mom? Or someone calling someone out in public and saying that's not your mom. Like, that's not okay. We build our families the way we build them. And I love that in all this, like, dare we say, like, chaos and struggle, there's this, you know, kind of day-to-day regular family working. It's like connections between a parent and a child, and going to school and going to the doctor and figuring out how to do math, family stuff. They've
Yeah.
created these. So I appreciate these stories so much because I don't think we tell enough of them. And I think it resonates. And yeah, and I'm super appreciative of it. So thank you.
yeah.
Yeah, thank you
Yeah.
for that. It is called Voices.
Grand voices support.
It's a
Yeah. Oh, okay. Gotcha. Yeah. Thank you for that link. Gonna be
um,
checking that out.
coordinator. You should absolutely reach out to her. I would reach out to her, Chester. And Amy, she's amazing. I mean, she is amazing. I think you all can't go wrong reaching out to Robin.
Cool.
Yeah, I
Will
think
do.
that would be perfect. So I know we're just about at 8:30. We've taken up an hour and a half of your time. Is there anything else you wanted to end with? We know you're coming back and we're so thrilled in August. But
Yeah, no, thank you for having me. This is just such a conversation that's near and dear to my heart.
Yeah.
Because the implications are so big, right? Like how they deal with just this generation will have such a ripple effect
Yeah.
for these families. So
If you think about abolishing child welfare, which I think about regularly, um, this could be one of the many ways that we can tackle this problem, you know, in a kind of compartmentalized ways. Just finding ways where these needs are being met already, and just figure out a way to get the financial end of it connected to the folks that are doing the work.
yep,
I mean,
right there with you. I can't say that's some of the work that we're working on here in Seattle, is just trying to resource people,
yeah, yep,
you know,
yep, yep,
in multiple ways. I mean, these grandparents and other caregivers need to be resourced so
yep,
desperately,
yep,
and right now more than ever
yeah.
in our time. in
Yeah,
our
100%.
For sure. Thank you, Dr.
So
Pittman. That was wonderful.
yeah,
Thank you, thank
thank
you,
you
thank you.
so much. We really appreciate it. And again, look forward to you coming back with us in August. So I hope you enjoy the rest of your summer in between.
Yeah, y'all too. Thank you so much. Take care.
Thank you so
Thank you
much.
very much.